Cutera's Excel V Plus is
really two different lasers in one adorable little laser box,
says Dr. Jeffrey Dover, co-director of skincare physicians in Chestnut Hill, Massachusetts, outside of Boston, and host of Cutera Experts Corner. In this third episode of the series, he leads a discussion about the versatility of the device.
Let's start off this section by talking about the two wavelengths in the box. It's really two different lasers in one adorable little laser box, but really you have two lasers. And I'm not sure that all of our users or all of our colleagues realize how versatile that other wavelength is. So we've talked a lot about 532, good for pigment, good for vascular, but what about the 1064?
Dr. Omar Ibrahimi, in private practice in Connecticut where he focuses on aesthetics, skin cancer, and Mohs surgery, was the first to weigh in.
So I think actually, if you think back at Cutera and their history, they're actually known for making the best 1064. It's got a real kind of true pulse, and it's I would say the gold standard of 1064s that are commercially available. So this wavelength in my practice, I use it for a variety of things. So treating veins around the eyes, treating post-sclerotherapy where I've gotten matting and I want to clean up and there's a deeper component to it. Treating deeper or larger vascular lesions like venous lakes, things like that. And I know this kind of sounds silly to say, but I think with the XLV Plus now, with having such large spot sizes, you can actually do clinically relevant hair removal with this device, which is really nice and you couldn't do previously.
Well, just to add to that last comment, I actually use it for hair removal because it's so much less painful than the other deliverers of long pulse Nd:YAG. I'm not sure exactly why, but it works exquisitely well for hair removal, as good as any of the other long pulse Nd:YAG lasers. Versatile, fast, big spot size, and the pain level is way lower than the others. So for sensitive teenage patients of mine who are dark skinned with a lot of hair, I have to tell you, it's become a workhorse.
Dr. Vic Ross, director of the Laser and Cosmetic Dermatology Unit at Scripps Clinic in San Diego, agrees.
Yeah, I agree. That's one of the things we use it for, too. I know Cutera makes the Enlighten HR, which is a more powerful one, but the contact cooling is key, and we did an experiment about a year ago also showing there was plume suppression with the contact cooling versus the spray cooling and refrigerated air. So that's another consideration with your staff and patients, so the smell isn't quite as bad. And the bigger, thicker sapphire block really does add a lot of comfort.
Vic, thanks. Omar, you treat a lot of vascular patients, people with facial redness. Do you use a lot of 1064? Is it used a lot in your practice?
So more for kind of rosacea and along those lines, I tend to use the 532. I don't really, I'm a little wary of using 1064 to treat telangiectasias on the face. I think you can do it, but you have to be very careful. You have to be, slow with how you're laying the spots down and trying not to overlap too much.
But what about other indications? What do you use the 1064? You've talked about it a bit. Do you do that a lot?
Sure. So treating like a venous lake or something, or a larger kind of angioma, I think the 1064 is great. I use it a lot, especially on the lip. You can dial down the spot to kind of match the size of the lesion clinically. I usually put a finger around the other side, deliver a pulse. Usually you can see this little endpoint of a little contraction. You can feel a little kickback on your finger, and it's beautiful. This is something with, one treatment, the lesion can go away, and these patients will love you.
The 1064 wavelength can be very useful for periocular veins. That's where Mary Lupo, a cosmetic dermatologist in New Orleans, uses it the most.
This is the number one use in my practice for the 1064. And I think the reason for that is I do so much filler. And an unintended consequence of temple filling is making those veins often more prominent. And sometimes, they had it before, but I think they make them more noticeable. And the important points are that you must have the treatment be outside the orbital rim and angle the beam away from the orbit. But this is an extremely effective method. And there are many things that make a woman who might have lovely skin feel like they look older. And the skeletal temple with or without the bulging, noticeable blue veins, are two of the things that really say I'm old. And women absolutely love to get rid of that, both of them, the temporal atrophy and the temporal and periorbital veins.
Mary, I'm glad we talked about this. It's something that I was originally somewhat fearful of doing. You're near the eye, you've got 1064, it's a potentially hazardous wavelength. I tell you, I do it on a very regular basis in my practice. I've only had one patient not respond now in 10 years. And I love doing it because we are safe, we're very cautious. I personally do it. I never delegate it, ever, not even to another physician, just because I'm so concerned. But as with you, we get beautiful results, men and women, more often in men, especially fair-skinned women, where you can see through the skin, that translucent, beautiful skin. Blue veins are a giveaway. But it's actually partly genetic and partly an age-related thing. And it's one of those things patients rarely come in asking. But have you noticed when you say, by the way, have you noticed you have little blue veins there or big ones? They say, yes, I've always wanted to treat them, but I didn't know you could. It's not well known. Would you agree?
Absolutely. In fact, that's a great idea. I think I may post a before and after on Instagram. Because people don't know. You know, when you post something that isn't widely known, you get phone calls and people go, I didn't know you could do that.
It's interesting. We wrote a blog about a Venus lake a few years ago. I cannot believe how many people have seen this blog. I didn't know anybody saw the blogs that I write because it seems like it goes out into the netherworld. This was a psychiatrist, 70-year-old woman who came in. She had seen a Harvard-trained dermatologist who was referring her to an oral surgeon for a lip wedge excision. And she said to the dermatologist, there's got to be a better way. I'm going to find someone else. So she found me, walked in, and I said, we can treat that in one treatment and it'll disappear. And she almost started to cry. We took some pictures, did the treatment. She was ecstatic. First thing she did was she went right back to the dermatologist and yelled at him and said, you're not a very good dermatologist. You need to learn what your colleagues are doing. So she let us post the pictures and a little blog. And since then, people come in and say, I saw this picture of this woman you treated. It's so interesting.
I had the exact same thing happen to me. Not the blog part, but a woman who came to me for a second opinion because someone wanted to do a lip wedge for a Venus lake. My jaw, I think I have a bruise from where my chin hit the ground. I couldn't believe it.
XLV Plus, 1064, I just happened to like 3 millimeter spot and about 40 milliseconds, pretty high energies, 140 to 160 joules per centimeter squared, almost painless, exquisite results, almost no downtime. Sometimes 2 or 3 treatments if they're big. It's remarkable. But you have to let your colleagues who are non-dermatologists, non-skin experts know about it because they don't know it's available. Vic.
The other thing I'll add is I do treat that area, but also veins, thicker veins on men's noses I treat with the 1064, these bigger vessels that are like 0.8 to 1.2 millimeters, because oftentimes at 532 they'll spasm, but they'll come back. And the other thing I do with the Dermstat handpiece, on very fair-skinned women, they'll get these tiny vessels on their upper eyelid, which they hate, and I'll take the little Dermstat handpiece, use the Zimmer Air Cooler, and put an eye shield in. And you can very, very cleverly, you can watch them just go away. It's very nice, and you don't have to put the big, thick sapphire window in there, which is nice as well.
So this is very important. The operative, though, is the eye shield. You do not want to treat the upper lid without putting an eye shield in. It's easy to learn how to do. You can be taught by ophthalmologists or ophthalmologic technicians. We do it a lot. You do not want to treat that upper lid and hope you don't damage the eye. It is not worth it, but beautiful results, men and women alike. It's pretty common, actually, and we used to be afraid to do it, but it works well. Omar, let's move on to laser genesis. We touched about this briefly in another segment, but this is an important part of your practice. Tell us what it is.
So laser genesis, basically what it does is it takes the 1064 nanometer wavelength and it uses it at a 300 microsecond pulse duration. And it's relatively low fluences, so typically around 5 joules per centimeter squared. And you're basically kind of painting the face, and typically you do about 5,000 pulses to cover a face. What I find that it's really great at is taking that young patient who wants to do something preventative or do something like a lunchtime procedure, because especially the younger patients, they don't want to deal with even a couple of days of downtime. They want something that's lunchtime, that's going to help preserve collagen. It's great for young patients that have post-acne erythema, people that like pore improvement or texture improvement. And I find oftentimes it's a great way to hold my patients that I've achieved a good result with my 532, traditionally treating their rosacea, to kind of keep their rosacea at bay with lower downtime kind of procedures. So it's really kind of a versatile thing. I don't know if I can really explain the mechanism by which it works, but I can tell you clinically, this is probably the most common use of my device, and it's something I can delegate because it's relatively safe and easy to do. So if you have someone trusted, it doesn't require the doc to actually be in the room. You can hand it off.
Omar, thanks. Let's go over this again. 1064 for patients who want either pore improvement or texture improvement or red improvement. How about brown?
I think certainly there's some conditions where you can treat brown with the 532.
So let's go back. But we've been talking about 1064 Genesis, correct?
Correct.
Good. So that's why I asked that question. So the 1064 Genesis, for the most part, would not help dyspigmentation, dyschromia, as Mary has described, brownish freckling. So that's the new 532 Genesis, which is brand new to the XLV Plus. Tell us about that and how you use it.
Yeah. So that's one of the nice things I don't think we've discussed is that now we're able to do the same thing, microsecond pulses, with the 532 nanometer wavelength. And so, obviously, I think this is something where, it's got a much higher absorption of not only just vascular, but also melanin. So I think it's traditionally what I was doing before to treat pigment, I was actually using my Enlighten and doing picotoning with that. But, I think this 532 is going to open up a lot of potential avenues to actually not only just treating pigment, but vascular lesions. I think we're still in the early phases of sorting out what it's going to be really useful for, though.
Could you imagine doing 1064 Genesis and 532 Genesis on the same patient on the same day?
I've actually tried
like
that.
Half and half.
I've tried not only half and half, but doing both in the same area, and it doesn't appear to add to the downtime.
Would you do one before the other? One in particular?
I would probably start with layering the deeper one first, and then come in more superficially. So 1064 and then 532.
Mary.
So I agree with you. We're still kind of learning. It's going to be very interesting when we talk in a few months and see what we're doing. But you didn't mention one of the things that I really use the 1064 micropulse for, and that is for active acne. And, as far as the mechanism of action, I think it has a direct effect on the sebaceous gland. And I have a group of patients in my practice who absolutely want absolutely no oral medication. They want no Accutane. They want no oral antibiotics. Maybe they'll let me give them a topical, but they want something that's natural or non-invasive, and they're incredibly happy. They get very nice results. We package it with 6 treatments, and they come in and they really like it. So that is another avenue for younger patients besides the millennial, facial, sort of facial toning with the 1064 micropulse. Use it for active acne.
Mary, thanks. So let's go to some details. 1064 Genesis procedure. Am I
Yes.
right? Is it still 5,000 pulses?
I use actually closer to 7 to 8.
And how long does it take to do a whole face 7,000 pulses?
No more than 15 minutes.
And I'm guessing it's the heat that's somehow damaging the sebaceous activity glands or the P. acnes, but Vic, what do you think?
There have been very few articles on this. There was a Japanese article many years ago that looked into laser genesis and why it might work, and there were a lot of cytokines involved. And it probably mirrors what Seaton and Chu had done with the old pulse dye laser, the low-fluence pulse dye laser. There is some heat, but it's not direct heating of the vessels in the sense that you're closing the vessels. But this heat starts this cascade of events, which presumably releases cytokines, which helps with acne scarring, and some dyspigmentation all at the same time, because it's been used for lots of things. And I think the mechanism is still challenging, but it does work in most patients.
Right. So what's very important here is sometimes we don't know why something works, but if everybody gets it to work over and over again, then you do it. It's safe. And it's effective, and Vic doesn't know why it works, and if he doesn't know, no one knows. But we'll one day know. But clearly it's multifactorial.
But there are a host of patients who I agree with Mary, is that they don't want medication. I don't know why they come to see me sometimes because they say, I want to do spironolactone, I want to do Accutane, I want to do this, I want to do that. I do tea tree oil, and that works well. So we probably, Cutera should package tea tree oil with the Laser Genesis package, and we could probably have all these holistic, happy people and get nice results. I don't know what the reason is. It's this, and I agree. I think Western medicine is sometimes we do too much, but I think that the laser really plays a role here, particularly in that group of patients sometimes.
You know, I think it was Kligman years ago who said that it takes a while for science to validate the observations of good physicians.
Well, Mary, you're right. Albert Kligman developed Retin-A, for those of you who don't know, and a bunch of other things. And for years, he was a big proponent of using tretinoin or Retin-A for photoaging. Ken Arndt and I wrote a series of articles in JAMA. It was called the Contempo issue. Every year was an update of every specialty. And so we were given the great honor of doing it for years. And we wrote on several occasions about how there was no data to support Albert Kligman's claims that tretinoin helped photoaging. And we said, until there's some data, we can't really recommend and don't think people should. Well, finally, they did a 3,000 patient study, which showed unequivocally it's the best thing for photoaging. And to this day, 20 plus years later, it still is. So we recanted and said he was right. But he was a brilliant man.
And he was observant.
A little outrageous, but brilliant. And he was very observant. He was right. And the science finally caught up to his observations, as it will in this case. But we have Mary, to my right, who treats a lot of patients. If it didn't work, they would tell her, right?
Absolutely. Absolutely. You know, the business model of our practices is to deliver results for our patients. And very seldom do they question your methods if you give them the results. So I guess in their mind, the end does justify the means.
Thank you very much. Let's finish with a couple of other topics. Let's talk a bit about variable cooling. This device has the best cooling in the industry. It's as good as an ice cube, but way tidier, right? It's bulk cooling. Vic, you're an expert in cooling. What's so special about variable cooling, and how does this work?
Well, as Omar referred to earlier, the advantage is you can titrate the cooling to either enhance vascular damage or pigment damage. So as you increase the cooling temperature from 5 to 10 to 15, you're going to pick off pigment more, and as you decrease it, pick off vessels more. So you can really titrate it to the application. So that's a nice enhancement that this tool has.
And so how does it work? So if I'm someone looking at this device, but it's not in front of me, where's the cooling? Where does it come from?
Well, the cooling comes from water that circulates through the handpiece, and it cools sapphire. Sapphire has extraordinarily high thermal conductivity, and so the so-called heat transfer coefficient, which is the amount of heat that can be extracted from the skin to the handpiece, is extraordinarily high. And the nice thing is you can just titrate this thing to change the heat transfer coefficient, which is really nice. So it's a great tool to have, and it takes a little practice, I think, to know exactly where to go to find that sweet spot.
But remarkably, the design of this is so elegant, and it's so quick. You literally hit the temperature you want. 5 degrees centigrade is the coldest it goes. If it went any colder, you'd actually freeze the skin and cause side effects. And it gets there in a matter of a minute, maybe a little more on a hot day. And when you touch your skin, it's unbelievably cold. And it's this big, beautiful window, but it doesn't affect your vision or visibility. In fact, it enhances it. It is remarkable. So you can get away with treatments which otherwise would be very painful and would cause blistering and scarring, but you got protection with cooling. And compared to what we had originally, where we put what we called the popsicle in the freezer, and then we attached it to the end, and it chilled for seconds, and then it was warm again, the patient would start to jump off the table. The difference is just unbelievable. So those who are just starting out with these devices assume it was always this good, but the engineers at Cutera deserve a lot of credit for having made a device that's so user-friendly for non-engineers. Wouldn't you agree?
I agree. The old days, you were like a test pilot. Every laser case was an adventure because the cooling was so unpredictable. We had white dots on patients, and we would start off well, but like the popsicles you talked about, they would warm up during the case. And now it's not an adventure at all. Everything was just much harder before, but now we can very safely apply these tools, and it's just a much more elegant procedure for the patient and the doctor.
Now, not to say that these are now idiot-proof procedures, but it takes some of the guesswork out, so the artistry is now in the hands of the physician or treating individual, as opposed to worrying about the technology failing and wondering what settings to use and how often to go over the area. Why don't we finish by asking the three of you, tell us about what you love about this XLV Plus. Why do you like it better than XLV? Why do you like it more than the Pulse Dye? Why is it such a workhorse in your practices? Let's start with Mary.
So I would never have a Pulse Dye because I didn't like the 220, the heat, the size, the noise, the recalibration. Those of you who know me know I have zero patience. So I love the speed of this device, the reliability, the elegance of it, the sophistication of it, the variety of patients that I can treat. I love the fact that it went big and it went small compared to what we had before. And it is, without question, I think the first best device for a dermatologist to purchase, because they can integrate it into their medical practice with their acne and their rosacea patients. They can kind of pivot a little bit to things like venous lakes and periorbital veins that aren't obviously cosmetic, but they are cash pay treatments. They're not covered by insurance. And you can go all the way to elegant aesthetic treatments to improve the canvas of the skin, help the red and the brown and the texture, and have a lot of very happy patients. And you're treating everyone from early 20s for the laser toning and maybe the acne, to 80-year-olds who have venous lakes and the large veins. So that's our practice. We see them from cradle to grave. And if I don't have a large pediatric population, but obviously with a pediatric population, you can treat the port wine. So this is really a cradle to grave device that is a very a good return on your investment if you are investing in laser technology as a dermatologist.
Mary, thank you. Omar?
Yeah, I think Mary did such a wonderful job highlighting the beauty of this device. At the end of the day, as a small practice owner, this is a device that's just being used all day, every day. I can hand it off for certain procedures where I don't need to be in the room. It's reliable. There's no consumable aspect to this device, so it's really a dream device from a financial perspective. As a laser dermatologist, I'm just in love with the fact that it makes me better. And one of the advantages we have as dermatologists is clinically we can kind of sort out what these lesions are, and the things like the enhanced cooling and the variable cooling and being able to adjust the temperature, or knowing when to use a large spot size or when to use the dermostat handpiece. These things, they did just basically augment me and help me get better results for my patients, and that makes me look good in their eyes. And at the end of the day, it's happy patients are going to keep your practice thriving.
Omar, thank you. Vic?
Yeah, we look at the XLV like the Tom Brady of lasers. If it goes down, it's a catastrophe, and the team will not perform nearly as well, certainly won't win a Super Bowl. And the critical two things that Mary left out, but she did a great job, that's what this is so easy. Two things I want to point out. One is the relative portability of the device. It's not something you can roll around like a hypercator, but it moves relatively seamlessly from room to room, uses the 110. And the second thing is the interface. The interface itself is fairly elegant. It's very easy to use. It doesn't take a lot of work to change the wavelength and change the spot sizes, and that saves time. And I'm impatient too. I might be more impatient than Mary. And I told a nurse the other day, I said, we'll never get that 5 minutes back. When we lose 5 minutes, I say that time never comes back, and that clock is very important. And the time it takes to take a slider out and recalibrate, you never get that time back. And I'm not such a great conversation with my patients. I'd rather just get the procedure done. And so let's move, and that's what the XLV does great.
Well, the three of you described it so well. This is one of the devices where the list of the attributes is so long, it's hard to encapsulate. It's like going to a great restaurant where you want all the appetizers and all the entrees and all the desserts, which doesn't happen very often, right? But it's small and it's versatile. 110, it's quiet, turns on and turns off, never breaks. So as Vic said, it's timely. 532 and 1064, treats red, treats brown, treats acne, treats vessels on the face and on the legs, can even do hair removal, and it works every time you turn it on. So it sounds to me like it's really hard to believe, but the XLV Plus is even better than the XLV. When I first heard they were going to upgrade the XLV, I thought, why would you do that? It's our best device.
In the end, Dr. Dover says,
The best device got even better.
if you haven't listened to the first episodes in the Cutera Experts Corner series, Listen now to discover more about Excel V+. You can also learn more by visiting Qterra.com. Thanks for listening.